Good day, my name is Dr. Audrey Delsink, and I'm honoured to be able to present our Healthy Pets, Healthy Community program, a One Health approach in low-income communities of South Africa. I'm presenting today on behalf of my colleague, Dr. Amos Chaudhary. Over the past 25 years, Humane Society International has been developing culturally sensitive approaches to managing roaming dogs and cats humanely, effectively, and sustainably. We work in a number of countries in Asia, North America, Central America, South America, and now South Africa to extend a philosophy of humane animal management. We provide guidance to governments at all levels, local organizations, universities, veterinarians, and communities on ways to address the root causes of animal-human conflict and animal suffering. HSI's science-based and robust data collection have resulted in numerous publications by our amazing team, a few of which I've showcased here. With a number of well-established programs across the globe, South Africa was identified as the next destination to establish a companion animal engagement program. So within South Africa, and despite the well-meaning efforts of many local animal welfare organizations, large numbers of domesticated animals continue to suffer from a range of veterinary and welfare issues, including excessive breeding, starvation and malnutrition, injury through accidents and fighting, disease, parasitic infection, inappropriate housing, overwork, inhumane transport and slaughter, intentional abuse, and general neglect. This results in a number of problems, including, but not limited to, animal abuse and cruel practices. For example, very heavy chains are used on running wires, no deworming and ectoparasitic treatments are administered, there's a low vaccination rate, a lot of illegal breeding and puppy selling occur. Dog euthanasia as well as cat euthanasia through surrenders. So we see a lot of pet owner surrenders with very high euthanasia rates at local veterinary clinics. We see a large number of free roaming dogs in the communities, meaning that there may be a low human-pet bond. Of course, this leads to a higher public health risk because of parasites and the zoonotic diseases. And we also see that there is a breakdown in the bylaws and the law enforcement of these because of backyard breeding and a lack of registration of pets. Our program is situated in South Africa's Cape Province, specifically in the Overberg region, which is in the Cape Agulhas Municipality in the towns of Struisbaai and Bredasdorp. Both these towns have a low and a high income region or community, and the low income community is situated in the Struisbaai North and the Bredasdorp East region. So our site choice was also based on the existing networks and partnerships that we have in the area, as well as the survey results that we gathered post a monitoring, evaluation, impact and assessment study, and a knowledge, attitudes and perspective survey that we did. HSI's modus operandi is that we work with local NGOs and stakeholders, as well as volunteers, to establish the building blocks of our program, and that is the data. This is fundamental to determine the baselines and the program objectives, such as, for example, what our vaccination and sterilization rates should be in the area. And so in this case, we would like to especially thank our hardworking volunteers and local stakeholders, and that is the Cape Agulhas Municipality, the Animal Anti-Cruelty League, and Lovable Pets. And here are some of them that helped participate in our survey in June of 2022. So as I mentioned, the survey component consisted of a knowledge, attitudes and practices household survey, as well as a street count of free roaming dogs within those two communities. And so we were paired up and we went with a local representative because of the language issue. And so we would go from house to house in a stratified manner, and we would question the owners with their willing participation, of course, and we would capture their answers in a mobile application. And the surveys took approximately 5 to 10 minutes of the respondents' time, and it was a robust survey covering a range of different perspectives. The street count was done uniformly with a specified route, conducted at the same time each day in order for us to determine what the number of free-roaming dogs in the various areas were. So jumping forward to the main findings of the surveys in terms of the sterilization and the ownership rates, what we found was that the sterilization rates in the communities of Struisbaai North and Bredasdorp East were remarkably lower than those of the other Struisbaai and Bredasdorp West areas, which were the more higher income areas. And so the aim of the program is absolutely to try and increase those sterilization rates to the benchmark of approximately 70% coverage. And so using the estimated owned dogs and cats as a benchmark, we would determine what that benchmark would be in terms of the actual number of animals that would need to be done. Again, the number of animals in the Bredasdorp East area was quite high as opposed to the other areas, except for the cats. And I must add that the estimated number of cats in general we felt was an undercount. There definitely was a different perception in the community areas about the role of cats and their presence in the home. So one of the results from the CAP survey was looking at the beliefs and the sterilization practices, and we found that this seriously did hinder the sterilization rates. So many respondents, whilst they were aware of the sterilization procedure, did not actually find sterilization necessary, and commonly cited beliefs were that male dogs did not need to be sterilized and that female dogs should at least have 1 litter of puppies before their sterilization. So in looking at the age and sex breakdown of the owned dogs in the Bredasdorp communities, what was very interesting in comparing the males and females and the actual ages was the demographics in terms of the young animals. It was very interesting that in the lower income communities there was a much higher preponderance of younger animals, say below 3 years of age, as opposed to older animals, whilst that was the reverse case in the higher income areas. So definitely demonstrating that there's a much higher influx of puppies in the area. So when we look at the Struisbaai North areas, what we found was that there also was a higher preponderance of younger animals in the area, from 3 years and below, although this wasn't as marked as in the Bredasdorp area, but certainly still a higher number. The CAP survey also demonstrated that there were barriers to responsible pet ownership in the sense that these practices were hindered by both high costs as well as a lack of knowledge that led to animal welfare concerns. So generally this was associated with prohibitive costs with regards to the costs themselves or the veterinary procedures, as well as the costs of travelling to the local veterinary facility, which was situated only in the local Bredasdorp town. Many respondents also reported not knowing what specific diseases such as rabies, parvovirus and other diseases were, and so their dogs weren't vaccinated against those diseases. And similarly, they weren't aware that these diseases were zoonotic and could actually pass the animal-human barrier. So one of the measures that we looked at was a dog bite rate, and this was because many of the dogs were either chained or on a running chain, or simply were free roaming because of a lack of fence or adequate enclosure of the owner's yards. And so given the human-animal contact rate, there was a concern that dog bites may be a factor. And indeed, 7.8% of the participants reported that someone in their household had been bitten by a dog in the last 12 months. And it was reported that it was a roaming dog in 65% of the cases. Interestingly, 14.1% of the Struisbaai North community members reported a dog bite. So there was a higher incidence in this smaller community of dog bite rate. So clearly this does pose a threat to the community members, which is quite a serious concern, especially with recent recordings of rabies in the Greater Overberg area. So this leads us to our proposed program with a One Health approach. Essentially, we are looking at a multifaceted initiative which aims to benefit lower income communities and the animals by improving spay neuter accessibility, promoting responsible pet ownership through humane education, and strengthening the municipal bylaws to protect the companion animals, pivoting on a One Health approach. So much has been said about One Health, and what does that mean essentially? So in essence, it says that animal health, human health, and environmental health are all dependent on each other, and that they are all linked. And our program, with this focus on One Health, tries to improve health outcomes for all three parts and recognizes that improving one part, other parts will also be affected. I love the name of our program, which is Healthy Pets, Healthier Communities. It was actually originally named Healthy Pets, Healthy Communities, but our mayor actually renamed the program to Healthier Communities in recognition that in having healthy pets, we ultimately resolve in a healthier community for all. And so some of the ways that we can achieve this One Health system for all is by vaccinating dogs against rabies, thereby keeping both dogs and humans safe, by reducing the free roaming dog populations, thereby reducing the number of risks of dog bites, by encouraging dog walking and waste disposal instead of allowing dogs to roam wild, thereby reducing animal waste in the streets, and of course reducing the spread of disease to humans and ultimately benefiting the health and the well-being of our environment in our communities. So the specific ways in which we aim to solve these issues through humane education are through school education programs, so specifically through teacher training programs, by targeting students of different age groups, by using education material, stories, the videos, and development of our students that are in the program. We also have these education materials in the different languages. South Africa actually has 11 national languages, and so we have materials printed in at least 5 different languages so that it is accessible to all. We're looking at a community education awareness program, again targeting youth and adults, women in the communities, as well as volunteers that can help to spread these awareness programs. We're also looking at influencer training programs, and so the key to this is identifying these influencers, and these are key people within the community that already have a passion for the community in which they live, an interest in animal welfare and well-being. And so we take these community champions under our wing, and we train them up to be passionate and spread the word about our program. And we also have these discussion or training sessions whereby we update members on what is happening in the campaign. Of course, we would like to adopt an adoption and foster network so that we can reduce the number of animals that are euthanized, and also to engender a program whereby we can rehome animals within the community and reduce, overall euthanasia rates. And then we're looking at local ownership of the program. Whilst HSI comes in and helps to facilitate the program, this is the program for the community, by the community. It wouldn't work without their active participation, and so we need our local ownership by the members within the community, and so it really is up to them with our guidance to take ownership of it. So we've already seen, and through the CAP survey, recognized that there are some barriers to accessing veterinary care, such as the cost of care, language, culture, geography, simply getting to the clinics, etc. And one of the ways in which we are trying to address these challenges is by looking at health clinics, by spay neuter events, and by partnering with local veterinary clinics. So through the health clinics, what we do is we actively adopt parasite treatments, vaccination and first aids, and we also adopt registration for spay, neuter and education events at these clinics. Through our spay and neuter events, we offer affordable to sponsored sterilization of animals within the communities. We offer the members pet wellness kits, so basically pet bowls, grooming kits, toys, parasitic treatments, etc., all to enhance the human-animal bond, the pet owner bond, and for ownership in their pets and pride in that sense. And of course through vaccination, 5-in-1 for dogs and cats, and then rabies, and of course parasitic treatment. And then we look to the local veterinary clinic or other stakeholders or organization models that we can work with them to provide services outside of the clinics and the nutrient health clinics that we provide. These are photos that we've taken from our health clinics in the field. You can see basic treatments such as parasitic treatments are lacking. And so it goes a long way to just provide the basic care for these animals. So what we're also looking at is ways in which we can partner with local service providers, because whilst clinics are available, dogs can come in and receive treatments and dipping, etc. But we're looking at ways in which we can partner with local shops to provide subsidized deworming, shampoos, chemicals for dips and site cleaning, so that both the home and the animals are treated consistently to get to the root of the program, so that it's an ongoing and consistent treatment. This year we have conducted 2 sterilization campaigns with EnviroVet in our study areas, and this program is taking a female-centric approach in which female animals are prioritized for sterilization over male animals. In March of 2023, a total of 59 cats and 155 dogs were sterilized and vaccinated against rabies. And so the majority, that is 69% of the total animals sterilized, were female. The local owners also brought in a total of 17 dogs and cats for various treatments at our clinic, and this was including for treatments of transmissible venereal tumor, TVT, demodectic mange and eye infections, as well as for basic puppy vaccinations. In May of 2023, so just a few short weeks ago, a total of 80 cats and 135 dogs were sterilized and vaccinated against rabies. And once again, the majority, that is 61% of the 215 animals sterilized, were female. Again, a number of dogs were treated for demodectic mange, kennel cough as well, TVT, biliary, and sadly a gunshot wound, which the animal was fine and treated for and will recover. And 12 puppies were vaccinated. 1 cat was also treated for severe upper respiratory tract infection. Sadly, he was tested positive for FIV and leukemia, and sadly was humanely euthanized. So sterilization events will be held each month throughout the remaining year, and so we are well on target to reach our 2,000 animal vaccination sterilization rate for our year. So our model program for South Africa is essentially that this year our focus is running and testing our model and conducting the various campaigns and outreaches for the remainder of the year. In 2024, our focus will be to work on how we can influence other municipalities to roll this benchmark program out within the Cape Province, and to support and find local and sustainable solutions. We also want to identify location-based challenges rather than just a general approach, because we know that there isn't a one-size-fits-all for every situation. In 2025, we'll continue with on-site training of the various program components and technology at these different sites. And then in 2026, the larger program assessments, that is the impact that we have had, will be conducted. We've also added some new protocols, which are quite pioneering. If I may say so myself on behalf of the team, we have actually adopted a tattoo system unique to the 2 areas for cats and for dogs. This is an easy identification for animals that have been sterilized through the program, and of course offers a unique identifier for the owners should the animals be lost or tragically killed in a motor vehicle accident, etc. Also, HSI has developed an app which is a brilliant way of recording the data based on the vaccinations and the population management program, which is unique in that it captures the tattoo number as well as the photo of the individual animal. So it's an incredibly robust and a very comprehensive tool based on the individual animal. In conclusion, we share the same localities and often the same homes when it comes to dogs and cats. It only makes sense that we take a unified approach to health as one health. In the words of our Cape Agulhas Municipality Mayor, Mr. Paul Swart, through the Healthy Pets, Healthier Community program, we wish to change the mindsets of our people to help them become better parents to their pets. Studies show that the bond between people and pets can change our lives. Healthy and happy pets improve our personal health and bring happiness to our homes. Hear, hear, never a true word was spoken. Thank you for your time, and with that, I'll take any questions.